The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Welcome to Ageless Health with yours truly, Dr. Tom Roselle, and a Happy New Year to everybody. I hope that 2026 turns out to be magnificent and that we all together will make an amazing life. And if you listen here, I'm going to give you keys to do that over a period of, the months that are ahead of us. I'm going to tell you what to do, how to do it. I'm going to tell you where to get things. And if you have any questions that you'd like me to address online or return a call to you, just simply go to drtomroselle.com and send it out. Happy to respond to you as quickly as I possibly can. But I promise you, I will respond to you and we'll get back and we'll discuss whatever is going on with you. Having said that, those of you in the Washington metropolitan area, coming up very soon, very quickly, on January the 14th at 6 p.m., I'm going to kick off our in-house continuing education program. And it's simply called 5 Primary Secrets of Ageless Health. I want you to live your best life possible. And I never do these programs, ever. I intervene, I throw stuff in, but I never run the program myself. So what we're going to do that night is I want you to join me, and we'll talk about what it's going to take to make you optimal. What are the things that you have to do to, really put that little edge on your life to give you the distance, the longevity, the things that you want. I mean, that goes back to my book years ago called Ageless Health, Health is a Do-It-Yourself program. But I want to give you that. We'll go over your lab work. We'll talk about what that really means, because most of your lab concerns, sometimes they're not so concerning. But we're living in a medical community that wants to, this is coming from yours truly, drug you and maintain you, but never give you the ground substances to move forward. But let's do this. Join me. All you have to do is go drtomroselle.com. You can do it there. You can go rosellecare.com. Or if you'd like to, call the office, 703-698-7117. And I'd love to meet you, love to shake your hand, love to answer your questions, and we'll have a really good time that night. I promise you. I'll get you to go, oh my God, I didn't know that. And then I'll get you to say, oh, I could really do something about that without drugs. That's the purpose. I want you to live long. I want you to live well. I want you to live dynamically, because that's your birthright. That's what you should be doing. So let's get into the program today. And we're going to be talking about something that everybody goes, oh my God, right? And what we're talking about is cancer and what we need to do to avoid it. What I want you to realize is that cancer rates in this country have exponentially increased, if you will, over the last 5 years, particularly, but over the last decade or so. And we're at a place right now where it's not a matter of, for a lot of people, if you're going to get it, it's when you're going to get it. I heard a physician say one day that, if a guy lives long enough, he's going to die of prostate cancer like everybody else. But no, you don't have to do that, my friends. There's ways of avoiding that. But we're seeing increases of all kinds of cancers, particularly in the age groups from about 30, 35 up to about 55. And it seems to be over the last 4 or 5 years. So we can extract ideas from that. We can make a hypothesis. So what happened and why are we so, susceptible to different types of cancers over the last 5 years? Well, what happened over the last 5 years? It's called 2 things. One, COVID virus. Second is all the vaccines that they put out there. Now, am I telling you that those are some of the triggering mechanisms? There are a lot of reporting agencies throughout the world that's going to tell you that, in fact, yes, the Pfizer, the Moderna, the J&J, and all the vaccines that came out and the booster shots and so forth dumbed down your immune system, but also provoked an exponential breakdown in good cellular function. Now, that's a whole program by itself. We can sit there and we can talk about it. And by the way, when you come on January 14th, in the privacy of this clinic at the Roselle Center for Healing, I will get into that intimately, and I will start talking to you about some of the real facts that are involved and what the thing you have to do, if you will, to make sure you, your family, the people that you care about are protected. And you can protect yourself if you catch it early enough. But what happens, it's devastating if you don't step up to the plate. It's devastating if you say, well, it's not going to happen to me. Well, there's a lot of people that said that, and they're no longer with us, because these turbo cancers, if you will, go from zero to dead in a very short period of time. Did you hear me? Zero to dead in a very short period of time. The statistics are there. Don't go into the drug companies, because they're not going to tell you the truth. Again, you're listening to Dr. Tom Roselle. You're going to get diversified opinions. If you go into the Copilot and all the chat GPTs and so forth, you're going to find a filter that if you don't ask the question the right way, you're not going to get the right answer. So there's ways of doing that. I'm going to give you some of those clues on the 14th. I'm going to tell you how to do that and how to query these things. And it's a chess game. And these AI back and forth are only as good as the information that's programmed in it. And I'll give you an example. I went to a conference back in August, and it was in Florida. It's called the National Convention. There's about 3,500 doctors there. And we were talking about, I taught in the morning, and in the afternoon, there was 1,000 people, 1,000 doctors sitting in this room. And it was the future of medicine and AI. And one of the docs said, that was on the panel, there were 6 people on the panel, and they said simply this, said, let's ask questions that are near and dear to our heart. Now, this is a room of functional medicine doctors, from chiropractors to acupuncturists to naturopathic physicians to physicians, MDs who do natural medicine. And the question was simply this: AI, what are the serious side effects that need to be noted because of all the vaccines, if you will, from age 0, birth, up to 18? There's 76 of them. And, what should we be aware of? So AI comes back on and simply says this. He said, there are no reported serious side effects, with the exception of injection site heat and irritation, some pain, flu-like symptoms, a little bit of intestinal tract disorder, and very rare conditions that you would see neurological something that would show up. So we all looked at each other, and everybody's going, BS, that's not what we know and what we see in our communities. They're covering up. Why are they coming up? So remember, I said it's about how you ask the question. Different question, same subject. AI. If you were a parent today, knowing what you know about the serious side effects of the vaccines for post-COVID, and also from 0 to 18 years of age, 76 vaccines. If you were a parent, would you allow your children, would you have your children vaccinated following the schedule in a nanosecond? No. Different questions, same subject. And that's what you have to learn. You have to learn how to ask questions. There was a patient that is an attorney in my office, and she's quite formidable. And I said, we're getting to the place in AI. I said, how's it affecting your practice? And she said, significantly. I said, it goes back to what you were taught in law school. And she looked at me. I said, you got to know the answer to the question before you ask the question. So you have to be observant and don't buy into the BS that's out there. Let's get into the program a little deeper and talk about what really is going on. We're going to get into 5 key steps today to avoid cancers, to be able to know what's going on and what the situation is. Because if you don't, you're going to succumb to a problem that you don't want to have to experience, because some of these cancers that we're seeing go from 0 to dead in a very short period of time. Let's start with this. Guys, did you know that your experience rate of cancer, breast cancer, let's take that one. We're not even going to go to prostate cancer. Your experience rate of breast cancer is a fraction of women. Now, years ago, it used to be almost non-existent, 1 in thousands and thousands. Now, depending on the author that you read, it can be 1%, way up to over 3% of all breast cancers are male. Why is it increasing? Ladies, why is your breast cancers on the rise as well? Why are they going up? What's going on behind the scenes? You would think at this stage of the game that they would, they would be going down, knowing what we know and how to fix things and so forth, but they're going up. And, if you do the research, then the next thing that you see is that the survival rate for women is about 83%. And they're talking about when survival rate means you're still alive 5 years from now with all the stuff that they do with chemotherapy and radiation and so forth. And breast amputation, my words, my choice, right? But here's the deal. Guys, you only have about a 75% survival over 5 years. You're less than women. So what's going on around us? So let's talk about that. Let's talk about what's really the triggering mechanisms. And as we get into the program today, I want to give you details of very specific situations that are not necessarily the things that are going to provoke good health with you, and particularly when it comes to cancer. So we know that cancer is on the rise. We know that there are several different triggering mechanisms that are well known, but there are things out there right now that are even more, oh my God, type of situations. Did you know, for example, that somebody who's a heavy smoker that we said, they're going to be predisposed to lung cancer may not get lung cancer. What they may end up with is large intestine cancer. And that goes to the old concept of positive, negative, yin, yang. You've heard that, there are organ systems that couple. Well, the lung and the large intestine go together, just like the heart and the small intestine go together, and the kidney and the bladder go together and so forth. But if you irritate one or the other, if you eat like garbage, the sugars, the sodas, the coffee, the black teas, the fast food, the fried foods, the GMO products, and so forth and so on. If that's your diet and everything comes out of a box or everything comes out of plastic and you're heating in your microwave all the time, and by the way, that's one of the things that you need to avoid, you're going to increase your risk of developing a cancer. It can either be the lung or it can be the bowel because they're yin, yang, positive, negative each other. A lot of you are sitting there saying, really? Nobody ever told us that. Well, because they're not looking at the body as a whole subject, meaning they're going to compartmentalize. They're looking at your lung and they say, well, if you smoke or if you live in a bad area, and by the way, if you vape, if you're a vapor, you better give the damn thing up because you're going to end up with lung something very quickly, either a fibrotic pattern where you can't open up your lungs anymore, you can't breathe, or you're going to end up with significant cancer. Now, we know that there are exposures in our environment. What's another one that we need to potentially avoid that can cause you all kinds of trouble? Plastic. How many of you go out and grab a plastic bottle, leave it in your car, it gets hot or it gets cold? Anytime you do that, you release estrogens. They're called xenoestrogenic irritations to the system. Estrogens. And guess what happens? Estrogens, particularly that are xenoestrogenic or artificial estrogens, have a horrible impact, particularly when they're not blunted, they're not balanced with something called progesterone. Now, we're going to get into that on the 14th as well, but I want you to understand what you're doing when you do that. Now, what's another piece? Microwave cooking. Microwave cooking is one of the worst things you can do. It changes the cellular structure of the food that you put in your body, and that vibrational level, and that's what it is. It's like a vibrational pattern that accelerates the movement of the atoms and the electrons in that food. It goes into your system, and now it's like a tuning fork. It continues to do that same thing to you, and now it provokes an abnormal shift, an abnormal change in your cellular expression. That's called your gene trait, right? So all of a sudden, now things aren't working the way they're supposed to. So you add that to all the garbage that we put into our system. Now, how many of you go out and have a soda twice a week, 3 times a week? How many of you drink sodas all day long? And you think that's your liquid? Well, let me tell you something about sodas. It is one of the worst things you can do in your body on a couple of different levels. It will cause cellular damage because it's an acid, that bubbly phosphoric stuff that's in there. Yep, absolutely 100%. And it causes irritation to the system. It pulls calcium out of the bones. Now it makes your bones much more permeable to all kinds of things. But in addition to that, most of your sodas are jacked up with what? They're jacked up with sugar, and particularly things like fructose and sucrose, and then the artificial sugars are even worse. And that by itself, fructose in any form, is one of the worst potential carcinogenic elements that exist. So I would start checking out the things you put in your body. I said, well, I do artificial sugars, I do stevia and so forth. Really do your research. Go into PubMed, go into magazines like Nature, go into magazines like the Townsend newsletter and look that up. But remember, query it in different ways. And then just don't read one article, read multiple articles. You can't just get stuck on somebody's viewpoint. You remember what I've said over the years? My job is to provoke you. My job is to make you think. My job is to say, hey, I don't believe you. And maybe you'll go out and you actually check it out. So is he right? And you go in and you read things like Joe Marcolla's website. The guy's got a tremendous amount of information that's out there, and he's been doing it for years and years. If you go to my website, if you go to my book, if you really want to know how to put your body together and have a reference, a very straightforward, not complicated reference, is Ageless Health. Health is a do-it-yourself program. I wrote that about 12 years ago, and it's all about how the body really works intimately and what you can do to support yourself. But that, by the way, that'll be available online still. You can go to agelesshealthstore.com. It's there. You can go to, I think, even on all the audio versions, and you get to listen to me narrate the book. But I promise you, it's a book that you should all have just as a reference guide and say, oh, wow. And at the back of the book, there's a lot of references that you can go and check those out. But let's get deeper into the program, because it's important that you really understand what's the triggers out there, why we have to avoid certain things. If you get into the computer and you go, how do I avoid cancer? They're going to tell you, well, sleep well and make sure you get a little exercise and make sure that you eat a well-balanced diet and make sure that you get quiet time for yourself. But they don't tell you about the triggering mechanisms of so many other different things. And we're going to get into that as we go through. So here's the deal. We're talking about 5 keys, right? 5 keys to avoid. We already said a couple of them. We said smoking, eating badly. What else? Vaping. And there's a lot more, by the way. They can stack in patterns like this. Making sure that you're not eating artificial stuff. Our food in this country, our food, for the most part, is not allowed. It's illegal to be imported into the EU and the European Union. Why? Because it's poison. It's a chemistry set. And when you put that stuff in your body, it's like anything else. There's a great piece online. I was looking the other day. I said, finally, somebody said it. There's a benzene pattern that is in a food that we commonly eat and give our kids because that's all they'll eat. What is it? It's called chicken nuggets. And when you see what it is and it gets in and it actually destroys tissue and it provokes a problem in cellular expression, meaning now your immune system isn't working the way it's supposed to, guess you got a problem, right? So understand that all of these artificial things out there are going to cause, besides clogging your arteries and screwing up your heart, and they're going to provoke the capacity for your body to repair itself. Subsequently, you're going to have a radical cell, and that causes what? Cancer. So we're talking about your gut. You have to make sure it's clean. And here's the other thing. How many of you have had dental work done where you've had, posts and crowns and things that you've had roots that have been repaired and so forth and so on? Do you understand that every tooth in your mouth has an organ system that it relates to? And so if you put metal in, or if you put an antibiotic in, but it doesn't get rid of the infection, it's in the bone, not in the tooth, in the bone, that'll go to the organ system. It's called organ tooth connection. You can look it up, and there's all kinds of charts out there. I would encourage you, take a look. Maybe next time you go and your doc says that, you need a root canal, you said just pull the tooth, because that's what I would recommend to you. Pull the tooth and then put an implant in. Don't leave that infected tooth in there to destroy the rest of your body. Pull the tooth. And so we have another predisposition, right? So we have to be aware that there are things that we're being exposed to on an ongoing basis that can be detrimental. And there's so many more. We're going to probably talk about far more than 5 different things today that can cause cancer problems. I promise you that if you start realizing that besides the weight that you have in your body and the inflammatory reaction that's provoking, cellular breakdown, how many of you are just sitting there in your front of a computer? How many are on cell phones all the time? How many of you, and you got the earplugs in, is damaging your brain? You're increasing your risk of brain cancer because of that. The things called glioblastomas. I promise you, if you look up everything that I'm saying to you today, you're going to find that what I'm saying is true. We get into the next part of the program. I'm going to tell you some of the things that you can do to make sure that you avoid that. Now we're just listing them, but we're coming up to a break. You're listening to Dr. Tom Roselle live, Ageless Health. This is for you. This is important that you get this data. Don't go away. We'll be right back after some really important information. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody. Welcome back to Ageless Health with yours truly, Dr. Tom Roselle. We're talking about 5 things that you need to do to prevent cancer formation. But I want to give you a little bit more data. We really went through a whole lot of information in the first part of the program, but I want to give you a little bit more because it's important that you're aware of what's really happening. How do we avoid cancers? How do we get rid of this stuff? How do we make sure that we stay strong? But let me give you some more data. The estimated number of new cancer cases this last year in 2025. Remember what I just said. The estimated number of new cancer cases, I'm okay this morning, and deaths. I'm going to give you that piece in 2025 for both sexes, male and female. Here's the deal. 2,041,910. That was just released. 2,041,910. Guys, you more than women. You get 1 million of those things, 53,250. Ladies, you're close behind at 988,000 and so forth. But here's the deal. 618,000 of you are going to die because of it. That's the actuarial estimates that are there. And the areas that they're hitting, oral cancers are on the rise, tongue, mouth, pharynx, So what's in our environment that's causing those things? They're just jacking up exponentially. That accounts for a huge number. It's about 60,000 new cases in that area, much more so than ever before. Digestive system, we're talking about 362,000. Respiratory system, 245,000. Could there be something in our environment that's causing it? I don't know about you, but I get really suspicious when I see statistics like that. Now I'm going to dig into it. I dug that out last night before as I was prepping for the program. But we've got to be able to do some things to protect ourselves. So let's get into a little bit more of kind of the avoidance situation. We're sitting here listing tons of stuff. We're everything from bad habits of exposures and vaping, and I'm seeing more and more people that are doing drugs on all kinds of levels. Do they have an effect? You bet that they do. So here's a couple things that I want you to be aware of. And some of this is me and just clinical experience over a period of many years. And some of it simply is common sense, right? So we know that if we look things up, we're going to see, make sure you eat a healthy diet. Okay, what does a healthy diet mean? Well, it means this. It means eating fresh meats and fresh vegetables, and it means make sure that they're lean and they're unprocessed and they're organic and they're grass-fed and they come from areas that are not adulterated with other types of exposures. Okay, that's number one. So tons and a little bit of fruit, not a lot of fruit. Everybody think, well, I eat a lot of fruit. No, and I drink a lot of juice. No. Remember what I said about juice, fructose? Remember what I said fructose is it carcinogenic? So let's not do that. We want to make sure that when we eat properly, we do what? We bake, we broil, we eat raw, we steam, we don't microwave, we try not to fry, we do it the right way. So, is a plant-based diet crucial for longevity? Well, take a look at Mediterranean diet. This old boy here is Sicilian. And I grew up with fresh meats, lamb and beef and fish and free-range chickens and so forth. That's how I was fed. And tons of vegetables at every meal. And then if we had a grain, it was an unadulterated, non-GMO grain. And by the way, remember, you've heard me say many times that the grain in this country is not anything as it should be because it's been adulterated, it's been magnified, it's been modified, it's been GMO'd and so forth. In Europe, they don't allow that to take place. So you got to clean the body up. So these lean proteins, and by the way, the fats and the proteins are good for you, if they're grass-fed. Butter is good for you. Olive oil is great for you. And avocado, yummy. And you get into even coconut oil. Those are the things that change. The short-chain fatty acids, they're called medium-chain triglycerides in coconut oil, are great for your brain and your nervous system. So let's not avoid them. Let's make sure that we get them in the system. How about exercise? You reach a place where you don't want to kill yourself. You're not an Olympic athlete. You're not going out running 10,000 miles and so forth. But when it comes to exercise, we want to talk about a mixture. What I like to recommend to my patients is strength training. Make sure we have good muscle tone. I want to also recommend to them something that's called HIIT training, HIIT. That's high intensity interval training. So how can you do that? You could do that walking. You go outside and you walk for 3 minutes. So I'm sorry. And then you walk like crazy, as fast as you possibly can for about 30 seconds, 45 seconds. Then you bring it down and you walk again, your normal walking pace. And then you crank it up for about a minute. Then you crank it up for another 35, 40 seconds. And you do that back and forth for about 15 minutes. No more than that. You do it 3 times a week. That's all you need to do. And then just go for a walk. Walk slowly. So even simple activities like walking dramatically increases your overall well-being and protects you and protects your body because of the oxygenation that's going in your system from things like cancer, right? Guess what? If you're depressed and you're anxious because you don't engage with people, you're on your stupid phones and your pads and all the time, your body's immunological system is going to crash and everything around you is going to be a problem. Are you getting enough sleep so your body can actually repair itself? How much sleep is necessary? At least 7 hours. I get 6.5, 7 hours most every day, but you want to make sure it's restful sleep. So because it supports your health and your well-being. What does that mean? A cold room, cold meaning 60 to 65 degrees. It means no input from your cell phone. Don't put your cell phone by your head. It means turn off all of the electronics in your room. Black room, totally black. And then guess what? How about stress patterns? When you're cranked up, your body doesn't know the difference between actual experiences and one that you're thinking about. So how about, we talk about mindfulness. What does that mean? Well, how about sitting down in a minute and tell your creator, thanks for another day. I really appreciate it. Help me get through this mess. And how about things that relax you? A little bit of gentle motion. You're sitting in the chair. Everybody's talking about Tai Chi. And actually, all it is moving things and just letting your body begin to accommodate, to open up the oxygenation pathways and get rid of the garbage that's in your lymphatic system and so forth. I promise you, if you learn how to manage stress, you'll live longer and you'll live healthier over a period of time. So, if we talk about things that you can find anywhere, simple habits, that support our body on an ongoing basis, instead of having to do something, find something that you like to do. And it won't cost you a dime. You can use, if you want to get exercise and strength resistance, grab a couple cans in your pantry and just work with them. Add a little bit of weight. That's all you have to do. Go for a walk. That's all you have to do. Go breathe. That's all you have to do. Get rid of the vaping and the cigarettes. That's all you have to do. And you do it one at a time. You don't have to spend a ton of money on things that you can't afford. Listen, health is easy to claim. It's easy to get you back if you really want to. If you don't want to, then you're going to die of some unnecessary stuff and you're not going to be here as long as the rest of us. I don't know about the rest of you, but I'm trying to figure out how I can get another 25, 30 years before I even think about leaving and make sure that I'm contributory to everybody around me and to help you, make decisions. Now, we're going to talk a little bit about nutrition on the program today. I'm going to get really deep into it on the 14th when you come to the office. Don't forget, on January 14th, I'm going to be hosting the first in-house program at the Roselle Center for Healing in Fairfax. So if you're anywhere near us, you'd like to attend, please register. All you have to do is go to Dr. Tom Roselle or rosellecare.com and register for that program. I'll have fun with you. I'll provoke you. I'll say, hey, how come your blood sugars are so high? And I can tell that just by looking at you. So let's talk about blood sugars. Blood sugars that are inflammatory, they feed cancer. So when your blood sugars get too high, it's not only that you're courting diabetes, but you're also increasing your risk of cancer. So what are you going to do to get it down? Well, how about stopping, the sugar binge? Get rid of the sugar bowl. Get rid of all the nonsense. And you say, oh my God, that's all I live on. I have a young boy who's 24 years old, is a patient of mine, and the guy's got some significant health issues and emotional issues and so forth. And the guy's a sugar junkie. And so I'm walking through and I'm not telling him to cut it out. I'm saying, I want you to add certain things. What do you mean? I said, well, I want you to make sure you get so much protein every day. And he looks at me and says, what's protein? I mean, he truly didn't know. And so I went through and I told him protein choices and so forth. And he kind of turned his nose up to it. He said, well, can I go get a hamburger at Mickey D's? No, that's not the kind of protein that I want you to have. The bun has at least 6 to 8 teaspoons of sugar in it. He looks at me, what? Yep. And I said, that soda that you got, at least 12 to 13 teaspoons of sugar in it. He says, huh? And I said, all of those are going to break your body down and cause all kinds of issues for you. So is that where you want to go? I said, I don't care. I don't have to live like that. I've got a whole lot of years on you. And I intend to live longer. But I tell you what, if you keep doing what you're doing right now, you're not going to make it this long. Kid looks at me and said, what are you talking about? So I'm sitting there. I'm the guy, thanks for, online AI. I can have computer in each treatment room. And I pop it up. I said, take a look. So you don't have to believe me. Take a look at that. So here's the deal. If you are a sugar junkie, you increase your risk exponentially of cancer because it's cancer's favorite food. They love it. So if all the chemtrails that are out there potentially may be problematic because of the beryllium and the aluminum that they're seeding their grounds with, if the garbage that they're putting into our our food sources are significant in there. If you've got a bad habit with vaping, or you're doing other kind of drugs and so forth, and now you add the sugar to it, that's the spark that is going to explode it. Listen to me. I am not telling you fallacies here. This is true stuff. Get in and do your homework. Either that, or understand that you're going to have a potential problem that's coming down the pike. Have you had your hormones done? Do you know what your progesterone, estrogen ratios are? Men, I'm talking to you too. Do you know what they are? If they are too low, they're going to be too low for several reasons. One, you have an organ system that sits on top of your kidneys. It's called what? It's called your adrenal glands. And your adrenal system, particularly as we get older, produces some of the primary components of estrogens, progesterones, DHEA, testosterone levels, and so forth. And if that sucker is beat up and it's broken down, you're not producing that stuff. You're not going to protect yourself. So don't you think you ought to know? There's an easy test, and it's not a blood test. It's a spit test. It's a salivary test, because that tells you what you actually have in your system. You take a salivary test, spit test, 4 times in one day, and it gives you a lot of data. It gives you your cortisol levels. They should be in a certain rhythm throughout the day. Should be the highest in the morning. If you wake up in the morning and you can't function, that's because your cortisol is either stored in tissue, but it's not provoking your wake up and let's go type of attitude. And then it drops down slowly over a period of time. It gives you DHEA, which is the mother hormone that provokes testosterone and estrogens and progesterones. And it gives you your insulin level. It tells you whether or not your insulin levels are getting beat up. And then your progesterone is a total, and it gives you your immune system, your antibody reaction. Wouldn't it be good to know that stuff so it hits you right square in the face? Next test that you could do is make sure you do something called a complete stool analysis. It doesn't mean a hemoccult test that your local MD is going to do just to see if you're bleeding. It means to find out what your microbiome is in your intestinal tract. All the good guys and all the bad guys, all the fungus and the mold, all the parasites that may leave their DNA trail. If you do the right test, they exist. So if you know that's there, wouldn't it be great to have that data? I don't know about you, but I'd like to know. And I'd like to get rid of all those nasties that are in there. We talked about making sure that you have no cavitation or holes in the bones of your mouth due to infections that shouldn't be there because they left the tooth end that should have been pulled. Now, if that's the case, wouldn't it be great to go get a scan done that actually looks at the bone itself? And to somebody who knows what they're doing with that, it's called a biological dentist. There's a lot of great guys out there. And, we have 3 or 4 that we highly recommend. But here's the deal. If you have an infection, remember in the tooth itself, got a problem. Now we're talking about the mouth. How many of you just grab any kind of toothpaste? You're grabbing it and they have fluoride on it, right? Because you think fluoride's the greatest thing that you can have, that is going to protect you from cavities. Well, my friends, here's the fallacy. Cavities are formed from the inside of the body to the tooth, not from the tooth inside down. And obviously good oral health is important. You don't want a mouthful of bacteria and so forth. But if you're putting the regular stuff in there, you're causing brain and heart problems because of the fluoride and the potential of increasing your risk of cancers, both oral, by the way, and brain and heart. The information's out there. Check it out. Call me on the information I'm giving you. But here's the deal. You're better off getting a salt shaker bottle, put it in some sea salt, and put it in baking soda, the rest of it, a little bit of sea salt, a lot of baking soda, and then get hydrogen peroxide and dampen your toothbrush with it, and then shake this stuff, put it in your hand, and then go like this, and then brush your teeth with that. You're going to kill bacteria. You're going to keep your teeth white. And the peroxide in the hydrogen peroxide is going to kill a lot of garbage and bacterium and viruses that you don't want to remember. Hydrogen peroxide kills viral elements. And that's one of the things that is going to provoke cancers. We know that today. We know that breast cancers and so forth are a combination of parasitic and viral elements. And that's why we see exponential rise in all this stuff. Guys, your prostate cancer, same thing. So once you want to kind of provoke that, and then you need to find out if you do have parasitic. We talked about a stool test that will give us a lot of that information. There's blood tests that will do it under dark field microscopy. There's lots of things, but you got to find out. and then take the appropriate steps, because most of your physicians, unfortunately, they're great guys, they're good people, but they don't know. They just don't know. Listen, we're coming up to a break. I hope I'm giving you a ton of data today, but it's stuff that you need to act on. And remember, January 14th, 6 p.m. at the Roselle Center for Healing. But don't go away. I've got a lot more for you. We're going to wrap this up and give you the things that you need to know about. You're listening to Dr. Tom Roselle. This is Ageless Health. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use. So I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back, everybody. This is Dr. Tom, and you're listening to Ageless Health, as you do every Saturday, same old time, right here on the Ageless Health Network. We're going to give you a tremendous amount of data and information as we go through over a period of time. And we're talking about a very important subject today. We're talking about cancer and the things that you need to do to prevent it. And remember, on January 14th, I'm going to be hosting the initial in-house continuing education program at the Roselle Center. It's something that I generally don't do anymore. I usually teach to doctors, and I'm on the road all the time and so forth, and do the podcast and do the radio program and all the things that I get involved with on an ongoing basis. But I decided to do this simply because of the fact that it's important that you start the year in a very fundamental place of understanding what you can do to optimize your health. And we're calling the in-house program 5 Primary Secrets of Ageless Health. And we're going to talk about what that means, but more importantly, what you can do about it. And we'll answer any questions that you have relative to your lab work. You can say, listen, my doctor said X, Y, and Z. What does that really mean? Do I have to worry about it? He's got me on a ton of statins. He's got me on this, is it necessary? I have a young patient right now who has cholesterol level. This young man is 26, coming up 27 years old. He's got a cholesterol level of 325. And his LDL levels are very high, but his triglycerides are good. His, his good guys, his HDLs are really, really good. His VLDL are very low. They're very low density lipoproteins, which are disaster. They're too high. So what did I tell him? Did I tell him you're going to die? You're going to plug up your arteries? Maybe. It could be a genetic pattern, which I think that has something to do, but also his problem is stress. And he's in a business where a vested banking firm that he works for, a lot of pressure on this young man. He's got a sweet tooth. So what he's doing is that it's telling me that he's going potentially into a fatty liver problem. So I'm putting it on him. I'm showing them the data. So if that's you, does it mean that you're plugging up your heart? No, it means you're screwing up your liver. And that has other side effects and ramifications that you need to know about. And we'll talk a little bit about that, as we go through. But the important thing is that it's not a statin problem. It's not your cholesterol is not just because, you're not, and they want you under 200, right? They want you 190 something or less, lower the better. Not so much. If you have low cholesterol, too low, you increase your risk of cancer. And that's the whole reason I'm bringing this up right now. You dramatically increase your risk of cancer. So when your doc wants you to put you on a statin, you should look up on AI, what is the increased incidence of cancer due to prolonged or high levels of statin on a day-to-day basis. I think you're going to be surprised when you ask the question the right way. Just remember what I said earlier. There are filters on these AI chats, right? There are filters. You have to ask the question several times in different ways, and you'll get a better understanding and you'll get the right information. And remember, if you want something from me privately, it's real simple. Go to drtomroselle.com, send me a note, and I'll happily give you my opinion, where to go, where to ask the questions, what are the things that you do. By the way, if you go to Ageless Health stored on our Dr. Tom Roselle's site, there's a product that is there, and it's immune support. It's shiakwa mushroom, not shiaga, but shiakwa mushroom, and it increases your immune response and supports cancer, meaning not supported to grow, supports it to reverse itself. So when you add a nutritional support, and there's a lot of things that you can do. If your cancer is a parasitic cancer, there are things like ivermectin and fenbendazole. There's, you can do culver's root, black walnut. You can do golden seal. All of those things are anti-parasitic, and there's ways of finding out if you have a parasitic involvement. So if that's the case, wouldn't it be cool to know exactly that? We'll talk about all kinds of things repetitively over a period of time. So you really get the information. You get it, and you can apply it, and you can do what's necessary to, to protect yourself. Because I want you to live long. I want you to live well. I want you to know the components. We talked a little bit about exercise today, right? Talked about HIIT training. We talked about strength training. Now, you don't have to go to the gym to get strength training. You can do gentle things. You can do Tai Chi and very gentle beginner stuff, just moving your body around. You can walk up and down the stairs. You can try to do 2 steps at a time once you've been able to do 1 step at a time. By the way, if you go upstairs and it hurts your back, it hurts your knees, that's your thigh muscles not firing the way it's supposed to, and you probably have a back problem. You need to get it taken care of. If you go downstairs and it hurts you, it's your hamstrings, and it could be some of the same thing. It could be intestinal tract irritation on either one of those, and you got to take a look at what you put in your body. If you look into the mirror and you got the saggy baggy button in front, and and it's not because it's toned, it's simply because of the fact you've been putting too much garbage into that system. Well, maybe it's really time to take stock and ask yourself a couple questions. Do I want to live longer, or do I want to kind of go out the hard way? I don't know about you, but my choice is the latter. Obviously, I want to not go out the hard way, or the former. I want to work a little harder. I want to put things back together. I want to make sure that I take the steps that are necessary. We're going to talk about exercise. We're going to talk about biochemistry. We're going to talk about your stress levels. We're going to talk about environmental exposures. We're going to talk about, we talked a lot about that today, but I'm going to get in depth on that. If you're on your cell phone all the time, my friends, I promise you're increasing your risk of damage to your body. If you're in front of a computer all the time without a filter in front of it, you're increasing your risk of dying of some of these things you don't want to do. If you eating as catch can, you don't worry about what you put in your body. You're increasing your sugar levels. You buy food from the center of the market and just kind of put your hand in and put something in your mouth so it quiets down the hunger pangs that you have. You're causing a problem. All these GLP weight loss products, guess what? We're seeing thyroid cancers show up because of that. They are not without their side effects. Don't think it's somebody else is going to happen to. It could happen to you. So what's the deal here? Check it out. If it happens to somebody, it could very well be you that it's going to happen to. Listen, let's talk about what we've talked about, okay? What do you got to do? You got to eat fresh, organic foods, period. End of story. You got to do it. If you put the other stuff in, you're going to cause problems, particularly with your gut. You have to stop the exposures of fumes and environmental toxins as best as you possibly can. You know, ladies, unfortunately, you know all the makeup you put on? They're loaded with estrogens. Look it up. They're loaded with estrogens. And if they're not natural things that you put in your system, those estrogenic components will increase your risk of all kinds of cancers, including breast cancers. Some of the other things that we've talked about. HIIT training. You got to go exercise. You got to exercise. You know, you could do it in a chair. You can move your arms and legs up and down, up and down, up and down, up and down, up and down as fast as you can. Then stop. Up and down, up and down, up and down, up and down, and then stop. Start there. Begin to move your arms around, just like this. Get some motion in your body. You're sitting at your desk and you're doing work. If those things are true, why aren't you doing them? You know, how about, we talked about electrical fields. We talked about watching your food sources, stuff that they inject in, the GMO modifications in products and so forth. Look at the drugs that you're taking. Many of the drugs that you're taking, the prescriptions that you're on, will significantly increase your risk of certain types of cancers. Go to drugs.com, put it in there. Research it. Say, what is the potential risk of cancer formation due to taking this? Let's say it comes back and say, well, slightly increase. Well, if you slightly increase that and you slightly increase your risk because you're eating microwave food all the time, you're slightly increasing your risk because you're drinking water out of a plastic bottle, which you should never do, by the way. If you're slightly increasing your risk because your stress level is so high and you start stacking and stacking and stacking, pretty soon all these slightly increases are going to do what? They're going to take you out. They're going to have that cancer, that prostate cancer. If you're not taking good immune support nutrition, like zinc, guys, for your prostate, the dry weight of the prostate in a healthy man is 50% zinc. So guess what? We eat zinc all the time. We eat it up in our body by stress, by smoking, by avoiding or trying to fight off immune problems and so forth. It's one of the number one deficiencies that we have in our system. If you go to the dentist and you have a mouthful of all kinds of implants, you have a mouthful of all kinds of root canals and so forth, I promise you, just doing that, you dramatically increase your risk of cancer someplace in your body. Depends on where the implant is. The back portion of your teeth, lung, large intestine. Front portion of your teeth, gonads, breast tissue, ovarian function, prostate function, and so forth. So think about it. Is it something that you really want to walk towards, or do you want to walk away from it? I don't know about you, but I don't want any part of that. Make sure you join me coming up on the 14th. Real quick now, right? About a week from now or so. 6 p.m. at the Roselle Center for Healing. Yours truly, I'm going to go through the process for you. I'm going to tell you what it is that you need to do, how you need to do it. We're going to really get into the nitty-gritty of it, and I'm going to answer your questions. I'm going to make it very personal for you. Yes, what does my lab work mean when I do this? How about your cancer markers? How many of you have had your doctor say, I want cancer markers done? And ask them if they really understand what those cancer markers actually mean. You'll know, because I'm going to tell you. I'm going to show you what they mean. I'm going to put them together for you. Wouldn't that be great? I'm going to tell you the foods that you need to avoid, that you think are good for you, that are not. Join me on the 14th. And join me here on Dr. Tom Roselle Live, Ageless Health, every week and I'll give you more pieces of the puzzle on an ongoing basis. We're coming up to the end of the program. It's always a pleasure for me to do this. I love giving this information out, provoking you to get the job done for one reason. One, you deserve it. But more importantly, I love you all. You have a great day. I'll see you on the 14th.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be